Recent research finds that as many as 60% of maternal deaths in the U.S. are preventable, and that increasing access to preconception, prenatal, and interconception care can reduce pregnancy-related complications. We're finding, as the statistics show, that those in minority groups, especially those who are Black, Hispanic, or even of the AAIN communities, are exposed to higher rates of maternal and fetal demise. I want to talk today about a couple social economic issues that can contribute to that. First, I want to jump into economic stability. People, especially Black women in particular, you will see less opportunities in employment, income. They'll have increased expenses, debt, medical bills, and financial support. Now, I want to mention that even those with a higher education level and those that do have good incomes will still, due to issues of systemic racism, still have increased fetal death and maternal death within the African American communities. But the social economic stability is a huge issue that plays a factor. It really limits their ability to have access to transportation, healthy food, healthcare coverage, the kind of providers that they can find, and then even the quality of care. I've found that that's a huge factor in educating minority groups, but especially African American women. You're also going to find specific issues in education. Statistic-wise, you'll find that those of a lower education level, even with white women as well, you will see higher outcomes of maternal death. But that statistics for African American women are even higher. I want to talk about how those social economic factors can play a huge role on a mother's maternal health. In physiology, we discuss how high cortisol levels in a normal human being can contribute to hypertension. It can contribute to depression, anxiety, lots of different things that can, even hyperlipidemia, those kind of things can develop with extended high cortisol levels. Stress hormones are naturally high during normal full-time labor, but if a woman goes into pregnancy with already high levels of stress hormones, she's likely to deliver prematurely. Statistics have shown that they think that high levels of stress hormones can increase incidences of preterm labor. Specifically, I want to talk about preeclampsia and eclampsia. Postpartum cardiomyopathy, which is a form of heart failure, and blood pressure disorders, preeclampsia and eclampsia, were some of the leading causes of maternal death for Black women, with mortality rates 5 times those of white women. Pregnant and postpartum Black women were also more than 2 times more likely than white women to die of hemorrhage or of embolism. I think that is such a staggering statistic, but I think it makes a lot of sense when you look at the socioeconomic factors as well. If they're constantly stressing about where they're going to be able to feed not only themselves, but maybe even their other children, if they have it, their family, they're going to be stressed about that. There was a statistics that shows that oftentimes Black women are the primary breadwinners and caregivers of their family. That's an extra burden on Black women. That burden and stress, comes from discrimination, can really add up. I personally worked in a family medicine clinic where I worked with a lot of refugees and lots of minority groups. And I found that the language barrier was a huge issue, whether they had complications in their pregnancy or whether the providers were really trying to communicate what the best options for them would be. I found that education, the resources for those communities, unless if it was everything lined up perfectly, there was a big disconnect in being able to provide mothers and children what they needed in order to support healthy pregnancies, which can result to things like hypertension, eclampsia, and can result in increased maternal death.